Hi, I'm Kim Thomas. I have been here with the family medicine residency for almost 9 years now, which is really hard for me to believe when I look back on that. So I moved to Alaska to take a faculty position here and had never lived in Alaska before, had never even visited Alaska until I came up here to interview for a job and fell in love with it like so many people do the first time that they come to visit. I knew that this was the kind of place that I wanted to be because I had always loved full scope family medicine. I am one of the faculty that does OB, love doing obstetrical care, and I love the mission of the residency to prepare family medicine residents to go and practice in rural Alaska and be able to take care of anything that comes through the door. And I really thought that mission sounded really exciting, and that was why I moved here 9 years ago and have loved it. My position in the residency has kind of changed over time. When I started, I was one of the regular faculty, like I said, one of the faculty that did OB with the residents, did deliveries with the residents. After a few years, I became one of the associate program directors, so got a chance to continue doing clinical work, but also think about the curriculum and help figure out what types of experiences really help residents get ready to practice in rural Alaska. And then after doing that for a while, my children became teenagers, and I decided I wanted to spend a little more time with them. So I cut back from being a regular faculty to just being a per diem or locums faculty is what we call it. And during that time, I transitioned to being the DIO at the residency, well, at the hospital as a whole, actually. One of the things that I've liked about the DIO role is it gives me a chance to kind of think about the broader experience of being a trainee at Providence in Alaska and think about how can Providence as a hospital really support our trainees, which is our residents and our fellows. We have the family medicine residency here. We have a palliative care fellowship as well. And we're working on developing an addiction medicine fellowship and, some other exciting things that may come up in the future, who knows? But I've really enjoyed the chance to step back and think about how the hospital can help keep residents and fellows learning and keep them safe. And that's been particularly important in this time with COVID. I love teaching residents. I think it helps me stay excited about a full scope practice of family medicine. I think working with residents and getting to know their patients and helping them think about how they can meet a patient where they are and help guide that patient to better health. I love that part. And I love the enthusiasm that all learners bring too, and that helps me stay enthusiastic. But the things that I have loved about Alaska is we live 10 minutes from the hospital, and I can, from my house, go running out on the trails, and I love that. I love that in my yard, just this year, I have seen lynx, bears, black bears this year, no grizzly bears this year, but grizzly bears other years. Oh, fox. And of course, snowshoe hares, eagles, ravens. My family really likes to backpack, and we can drive 20 minutes from our house and go backpacking somewhere where genuinely we won't see anyone else after we get an hour down the trail. And other places that I've lived, that was not the case. So that's one of the things that I love about living here.